Tazeen, are you ready? Can we begin?
Yes, ma'am, very much ready.
Okay, come on. Let's
So we,
begin then.
okay, ma'am. A very good morning to one and all present on the board. On behalf of Dr. Father Principal P. Anthony Raj, IQAC Loyola College of Education, this is Tazeen Ahmed, Assistant Professor, Loyola College of Education, extending a warm and hearty welcome to all the dignitaries and participants to this one-day webinar titled Rose Day Cancer Awareness. Loyola College of Education, in collaboration with Inner Wheel Club of Jamshedpur, observes this World Rose Day on 22nd September 2020. World Rose Day is observed to support and to infuse hope among cancer patients all over the world. Cancer is the second leading cause of death in today's world. Having set the tone, I now call upon Dr. Monica Uppal, Dean of Academics, Loyola College of Education, to take on the proceedings of the day. Dr. Monica Uppal is a name to reckon with in the field of academics, especially teacher education. Her 23 years of relentless and dedicated services, accompanied with two PhD degrees and a recipient of Rashtrapati Gaurav Award, sets her a class apart. Now, I welcome Monica ma'am to take over the proceedings of the day. Over to Monica ma'am.
Thank you, Tazeen. Let's start the day with a prayer. So now I request Manju Kumari to start with the prayer song.
Thank you, ma'am. Good morning to all. लगन लगी तुम्हारे शरण की लगन लगी तुम्हारे शरण की चरण का विधि तुरी लगन लगी तुम्हारे शरण की रतन लगी तेरे नाम की रतन लगी तेरे नाम की दरस बिना कैसे फल की राम रंग सपन बुझाई लगन लगी तुम्हारे शरण की वो पालनहारे निर्गुण और न्यारे तुमरे बिन हमरा कोनो नाही हमरी उलझन तुमरे बिन हमरा कौन नहीं, तुमरे बिन हमरा कौन नहीं, तुमरे बिन हमरा कौन नहीं. Ma'am, am I audible?
Yes.
Hmm.
Prayer. Thank you, Manju. Prayer is an expression of total faith in the present power within and around us. When we pray with faith, we express it through a sincere thanks to Him. He fulfills our desires if we call upon Him and acknowledge Him. Thank you, Manju Kumari, for uplifting our spiritual quotient at the onstart.
Welcome, ma'am.
A very good morning to our chief speaker, Dr. Vaishnavi, Inner Wheel Club President, Mrs. Navita, members of Inner Wheel Club, professors of our college, and my dear students. You all know an old proverb saying health is wealth, which is, however, very true for the humanity. It indicates a very clear meaning that health is more important for a person than the wealth. A healthy person can perform any task. However, a wealthy person who's suffering from untreatable disease like cancer can never buy good health. A healthy person, may be rich or poor, lives more happy and peaceful life than any rich person having a diseased body. A healthy person becomes more energetic and work with full efficiency to earn wealth. And a rich but a diseased person gets easily tired, physically and mentally. Building health is tough, continuous, and time taking procedure. So let us not lose this health. Unhealthy person spends a lot of money on medicines and doctors. So it's better to take care of our health and take proper precautions. Good health is indeed the most beneficial boon to the humanity by nature. It is the most precious jewel and the real jewel of life, I would say. If a person doesn't have good health, he can not even earn a lot of money and not even enjoy. So the real wealth is your health. We should definitely, we all know we should do regular exercise, we should eat balanced food, we should have positive thoughts, we should have cleanliness, we should have fresh environment. All these things we already know about. But then there are certain things which we are lagging behind. And I thought with this collaborating it with Inner Wheel Club, I thought that let our students, the younger generation, the youth today be aware of such deadly diseases which are there and they can prevent themselves, their family, and the students and their families when they become teachers. So you with what will the upcoming teachers of tomorrow, I think you all should know that what and how you can make your children healthy. With this mobiles and the gadgets coming in, children are becoming very lazy. Let us inculcate in them the virtue of good health. A sound mind represents the existence of sound body. So a healthy person is capable of doing and performing the task better and for longer hours. The life is going to be tough ahead. So therefore, definitely, when the president of Inner Wheel Club, she told me that she wants to conduct one awareness talk with you all. I absolutely agreed to that, and thank you to the principal who agreed, and therefore we are here today. So I welcome the president of Inner Wheel Club, Mrs. Navita Prasad. I welcome the members, Mrs. Dimpy Grewal, Mitali, and there are few more here. So I welcome all of you to Loyola College, and with gratitude and with a lot of love, we expect you to be here. And oh, I can see the Vinder auntie also here. So I, uh, I really welcome them to Loyola College of Education, and definitely to Dr. Vaishnavi, the chief speaker. I really would like to tell my students at the onstart that once she finishes with her talk, you are free to ask questions. Please do ask questions. That is one opportunity that you are getting here. You ask questions related to the topic and to any medical concern topic. I'm sure she's there to help you out. Right. So I really welcome each one of you here to Loyola College. I hope you'll enjoy the talk today. So I hope with all this, we all will benefit by today's talk. So Dr. Vaishnavi, thank you for taking out time for us. Thank you, Doctor. I know you are quite busy with the days like this, but I really want to thank you for accepting our offer. So thank you, Dr. Vaishnavi. And now I will hand over it to Mrs. Navita to introduce the doctor. Thank you.
Thank you, Dr. Monica. I'm really grateful to Loyola College for giving us an opportunity to present an awareness talk on cancer on Rose Day. And when I approached Dr. Monica, she was so cooperative, and I'm grateful to her for that. And I would like to thank Father P. Raj, principal of Loyola College, also for giving us this opportunity. We have gathered here for an awareness talk on cancer, and I would like to request our convener for cancer awareness, Mrs. Dipi. So I would request Mrs. Grewal to please give us a purpose of this awareness talk. Thank you.
Good morning, friends. I just want to share with you all a brief history of the significance of Rose Day. September 22nd is celebrated as World Rose Day all around the world. It is observed in the memory of a 12-year-old Canadian girl named Melinda Rose. She was diagnosed with Atkins tumor, which is a rare form of blood cancer. Now, this young girl continued to fight her condition bravely and touched many lives with her amazing spirit and zest for life. She would send emails, cards, poems to cancer patients, hence bringing joy into their lives. Rose, as we all know, is a symbol of love, concern, and tenderness. Hence, every year it is celebrated as a day to bring happiness in the lives of cancer patients and also to spread awareness about the disease. In Jamshedpur, we have been celebrating it every year by distributing roses to doctors, healthcare workers, and patients, thus adding joy and smile into their lives. But sadly, this year it's not possible. Hence, we've decided to have this program. Thank you.
Thank you, Dipiji. Without wasting much time, I would like to introduce our chief speaker for today, Dr. Vaishnavi Peruma Reddy. She is the senior resident, Department of Radiation Oncology, Meherbai Tata Memorial Hospital. Dr. Vaishnavi has done her MBBS from Narayana Medical College in Nellore, Andhra Pradesh, and has done her MD from Vaidehi Institute of Medical Sciences and Research Center, Bangalore, under the Rajiv Gandhi University of Health Sciences. She has been in the oncology department since 2015 and has done screening camps organized by the Indian Cancer Society at Karnataka. She has worked as a clinical assistant in the Department of Radiation Oncology at Kokilaben Dhirubhai Ambani Hospital, Mumbai, till March 2020. And she has been associated with Meherbai Tata Memorial Hospital since June 2020. I would request now Dr. Vaishnavi to please present her awareness talk to the gathering. Dr. Vaishnavi.
Thank you. Thank you, ma'am. Ma'am, do I start?
Doctor, do you want the PPT now?
So, good morning to one and all who are all present here. And I very thank you for welcoming me for the talk. Sure, ma'am.
Sujit, can you just present the screen? Yes, just share the screen.
Ma'am, may I start it?
Yes, please.
Yeah, sure. Thank you, first of all, for giving me the opportunity for taking a lecture on cancer awareness. So, as they have formally introduced me, but let me introduce myself. And I am Dr. Vaishnavi Perma Reddy, a radiation oncologist currently working at Meherbai Tata Memorial Hospital as a senior resident. So, good morning to one and all. Today, I'll be taking a class about cancer awareness in general. So, coming to the next slide. So, let me get you through all the things. What is cancer, first of all, and how do you deal with it? Like, what are the screening programs, or what are the symptoms which you see in cancers, and how to like prevent it to some extent, and what are the measures to be taken, and what are the risk factors for causing like, for the causative reasons of cancer. So let me go through every in detail, and then I'll be taking you to the most common cancers in the females. So coming to what is cancer. So as everyone have a general idea of what cancer is, but let me tell you like what in cancer is in general. So cancer is like there are cells in our body which are like functional unit of our bodies. So then these cells, when they grow regularly, they'll not have any problem. So once they start growing out of control and they start invading other tissues, then they become cancerous usually. So once these cancerous cells start accumulating, what these cause? These cancer cells, these cells become cancerous due to accumulation of defects, like defects in the DNA, which is caused due to mutations or due to inherited genetic traits and infections. These are the most common causes. So once the cells are damaged, our body has an immune system, or our body has a capacity to detect and to repair the damages which has been occurred in the DNA or in the cell. But most of the time, the cells will be available, cells will be able to detect and repair the damage which had been occurred. So when these cells cannot be able to repair, so please next slide, please. So when the cell is severely damaged or when it cannot be repaired by itself, then usually the cell will undergo death by itself, which is called programmed cell death. Like the cell dies. So once the cancer occurs, when cancer occurs, when these damaged cells start growing very uncontrollably and they divide rapidly and they spread abnormally instead of self-destructing as they should. So once they start spreading, what are the features of a cancer cell? Cancer cells are usually parasitic. See, once there is a cell, it does need nutrients for its to survive in a body. So our body, human body, has a good favorable environment for any kind of infection or for any kind of cell or to grow. So once that is invaded, so it starts growing. So once it starts growing, it needs nutrition for its survival. So under favorable conditions, environment, and under favorable nutrition, it starts growing and proliferating very rapidly. So once these are parasitic, mean they feed on our nutrients like blood vessels. They generate new blood vessels for its blood supply and they start proliferating rapidly. And these are useless cells because they are not useful to our body and they are very harmful to our body. And as I already told you, these cells multiply very rapidly and start destroying the normal surrounding tissues which are there. And usually cancer spreads either by local spread or by lymphatics or through by distant spread. These are the three different ways of spread in our body. So as I told, tumors are like not all the tumors are cancerous. That is the main thing which is to be noted, because there are two types of tumors. One is a benign tumor and the other one is being malignant tumor. So benign tumors are not usually considered as cancers because see, these cells grow at a very slow phase, like slowly, and they are usually localized and they're not spread to any other parts of the body. So whereas malignant tumors, these tend to grow very rapidly in a small amount of time, and they either spread through the lymphatics or the blood vessels, or they spread locally also, and they destroy surrounding normal tissues. Whereas in benign tumors, the surrounding normal tissues will be normal, and it will be localized, and it is very slow growing tumors. And coming to the global cancer burden, I mean, this global cancer burden is currently in India. So this is like second leading cause of death, which is seen in India, and there are estimated 9.6 million deaths in around 2018, which will be growing rapidly by the end of 2030 or 2040. So about like 1 in 6 deaths is due to cancer, and approximately 70% of the deaths from cancers occur in lower and middle income countries, because in these countries the awareness of cancers is very less among the people. That is the first thing which comes into mind. So coming to the incidence, most common cancers which these days are like lung, breast cancers, colorectal cancers, cervical cancers. These are the most common cases which we are going to see. But the rest of the cancers constitute like the smaller percentages when compared to these cancers. And head and neck, like oral cavity cancers, which are most commonly seen in India because of all this tobacco uses and all this, and less of awareness. And coming to the mortality, most commonly highest mortality is seen in the lung cancers and the colorectal cancers, followed by stomach, liver, and breast cancers. So it depends. The mortality will be depending upon the time when you detect the cancer and based on the treatment which will be received. And coming to the what are the causes for cancer? So there are many causes uh, which people know already. Actually, the main is tobacco use, which causes around 33% of risk, and there is excess weight and obesity, which is now has been like most common in our uh, society because of sedentary lifestyles. And coming to the diet, lot of junk foods and lesser healthy foods, and the lack of exercises. Coming to the occupational hazards and viruses and genetically inherited mutations like family history of cancers, alcohol, ionizing radiations or UV radiations exposure, and prescription drugs. And there are many other reproductive factors, pollution, and there are other unknown factors like around 11% which constitute for unknown. And generally, who do get cancer? Who can get cancer? Like everyone. It's not like significant age group or only males can get or it or females can get or only younger can get or older can get. So like everybody or anybody can get cancer, including the infants or children. No one has an exception. So coming to the number of new cases which has been diagnosed in 2018, especially in females, like now of all ages. So breast cancer was the most common cancer which has been seen till 2018. These are according to the WHO guidelines, the WHO published features, and these are these are the statistics which I am telling about Indian scenario. So these are breast cancers are the most common, constituting of around 27.7%, and cervical cancers being the next, and then next ovarian cancers, oral cavities, colorectal cancers, and the other cancers constitute around 41%. So these are the 2009 cancer deaths in females by percentages, which are most common being 22% in lung and bronchus, and 15% are breast cancers, 9% colorectal cancers, 8% pancreas, 5% ovaries, and 5% uterine, and 4% liver, 3% leukemia, and 3% NHLs, and 3% brain and nervous system cancers, and 23% will be miscellaneous or the unknown cancers, the other cancers. So, what are the most common symptoms which you see in malignancies or cancers? So, in breast cancers, what are the common symptoms which you see are the lump in breast, asymmetry, there is a skin retraction or nipple retraction, blood discharge or blood stained nipple discharge, eczematous changes, like there are any skin changes in the areola region or the breast region. Coming to the cervical cancers, postcoital bleeding, excessive vaginal discharge, and I'll be talking to about breast and cervical cancers in detail later on. So coming to the basic symptoms, and colorectal cancers, which you see bowel habits are changed usually, unexplained weight loss, anemia, so blood in the stools, which are usually caused in rectal cancers. And coming to the oral cavity cancers, there will be white patchy lesions or red colored lesions which are called erythroplakias, or there might be growth or ulceration in the mouth. So usually they start growing very rapidly. So and it is easier to detect as it is growing very faster. So coming to the nasopharynx, there will be nasal bleeds and permanent blocked nose, and there will be stuffiness of the nose, and there will be nodes in the upper part of your neck. So coming to the larynx, there will be hoarseness of voice, and there will be edematous region or persistent continuous hoarseness of voice. And coming difficulty in swallowing is also other thing. Coming to the stomach, there will be upper abdominal pain, any recent onset of indigestion, weight loss, unexplained weight loss. And coming to the skin lesions like skin cancers, or browny lesions which are growing with like irregular borders or any patchy colorations that usually itch or bleed. Unexplained these are. And these are usually short standing, not like long standing ones. And other skin cancers are keratosis. And coming to the urinary bladder, there might be pain, frequency or increased frequency of urination, and there might be burning sensation or pain while urination or blood in urine. And coming to the prostate cancers, and difficulty in urination or frequently going to the washroom during night times. So, and the other ones are retinoblastoma, are like usually seen in the kids or like very smaller age group usually. So these are seen as white spots in the pupil region in the eye, and there'll be strabismus that in a child. Strabismus in the strabismus. So testis, there'll be swelling of one testicle, and there might be asymmetry of the testis. The most common symptoms which would be seen in cancers. And coming to the screening procedures which are usually done for most common cancers in female are cervical, breast, and colorectal cancers. And these three constitute one of the major chunk of cancers which are seen among Indian population in females. And coming to the cervical cancers, and usually the screening tests are HPV test, which is like, this is a virus. HPV is a virus, which is the most common cause of cervical cancers. And this is like human papilloma virus. So these tests will be available, and this optimal age would be around 30 to 49 years of age, and frequency is like every 3 to 5 years it should be done depending upon the test used. So it might be HPV test or visual inspection with acetic acid. So visually we see if there is any lesion or not, if there is any irregularity, or if there is any difference which we see other than the normal tissue. So we tend to put acetic acid dye, so to see if there is any staining or not. And the other one being pap smear. And coming to the breast cancers, usually mammography is the most used technique for screening. And there is other one called self breast examination or clinical breast examination, which is done by people themselves. But due to inadequate data, they have taken it out from the screening procedures recently by the WHO. And the optimal age being 50 to 69 years, and frequency will be every 2 years. And coming to the colorectal cancers, there might be stool for goic acid, endoscopy or sigmoidoscopy, and so these optimal age will be around generally 50 to 70 years of age, and frequency is around 1 to 2 years, every 1 to 2 years, depending upon the test which we are going to use. And coming to the clinical interventions, this I would usually say at the last, because see, one thing was I would talk about this slide as like clinical interventions. So first thing will be early detection of the cancer. I would say early detection of the cancer would be the first thing, or prevention or screening. First would be prevention, then screening, early detection. If there is any detection, like early detection, then you go for the diagnosis, and then you go for the treatments, which are wide rangely available these days because of all the researches which has been going on all these years meticulously. And the treatment options you've already known regarding this, like surgical options are there. You go for chemotherapy, you go for radiation therapy. So these are many options which are for cancer treatment, and then follow-ups, and then survivorships, and then end of life care. So it goes in a regular pattern which is there usually. And in treatment there is a part called palliative care, which is before the end of life care, which is called. And coming to the cancer cervix, one of the most commonly seen female cancers, male gynecological cancer, which we are seeing currently. So coming to the next slide. So the risk factors which are usually associated with for developing cancer cervix are HPV infection, I've already told you, and youngest age at the first sexual intercourse, like that is less than 16 years of age, and multiple sexual partners, smoking, and race, and there is high parity. High parity in the sense multiple pregnancies or multiple births, and coming to low socioeconomic status. And coming to the cervical cancer screening guidelines, usually cancer screening should begin at the age of around 21 years of age, and then preferred screening tests at like and frequency will be vary by age of the person. So coming to the age, so from 21 to 29 years of age, the frequency with which the screening is done is every 3 years, and usually the preferred test would be pap smear. And the other thing, if and HPV testing is also most widely recommended these days. And if 30 to 65 years of age group, it's done in every 5 years, and HPV and pap tests are used. And what is pap smear? So these tests, what we do is we take cells from the surface of the cervix, and we look for any abnormalities in the cells other than the normal. So if there is any abnormal cells which can be detected, so they can be treated before the cervical cancer develops into a malignancy. So when it is like pre-malignant condition, which we usually call as dysplasia or something, so we can treat in early itself so that it doesn't develop into a malignancy, and the patient would survive more. So usually the cervix is visualized with the speculum, and then we take a brush which is there, and then there will be a spatula. So we take a smear from the cervical endocervical junction, and then we look for any abnormality in the cells. Coming to the colposcopy, and this is not commonly used, but I can take this into visual inspection, by use of magnifying instrument. Like this is used for visually inspecting the cervical region for any tissue abnormality, and so that which naked eye cannot be taken up. Through which naked eye cannot be taken up. So what is cervical biopsy? So if you get any abnormality in your pap smear, or if you see any irregular growth in the colposcopy or in a visual inspection, like visual examination, then we go for a biopsy. Like we take a punch biopsy. The forceps which are shown below, these are called punch biopsy forceps. So we take the forceps, and then we take a small piece of tissue which looks abnormal, and then we send it for examination to check for malignancy. And if you usually if they come as positive, then it is usually significant that they'll be taken under malignancies. So these are the cervical cancer vaccines which I would be telling about. So coming to prevention, so these are Cervarix and Gardasil vaccines. These are most common vaccines which are being used in India currently for the prevention of cervical cancers. So I'll be telling about the vaccines. So what is cervical cancer vaccine? And these vaccines are also also known as the human papilloma virus or HPV vaccines. So which will help in prevention of the cervical cancers by providing protection from the virus, which is the most common cause of cervical cancer. And then so you can significantly decrease the chances of getting cervical cancers. And so benefit of so recommended age groups. So usually recommended usually cervical cancer vaccines are usually given for girls who are starting from 9 to 10 years of age, because they are eligible for vaccinations. And coming to 11 to 12 years of group, these are the recommended age group to receive cervical cancer vaccine. And coming to 13 to 18 years of age, they are also eligible to receive vaccine if not previously vaccinated for cervical cancers. And coming to the women being age group of 19 to 26 years, these are eligible for the vaccine if not previously vaccinated for cervical cancers. And 27 or older, they are not approved by the FDA for officially giving, and for men too. And the effectiveness of the vaccine will be reduced as the age increases. So, is cervical cancer right for cancer vaccine right for me? If you are a female between ages of 11 to 12 years, then the vaccine has been proven to be having a greater benefit for people, for children, like girl children. So if you have started having sex, or if you can still have the vaccine. Like early ages of intercourse is like one of the most common risk factors for developing cervical cancers, but still people can take it. But the benefit from the vaccine will be lower because you may have already been exposed to HPV virus. And the vaccine does not eliminate, if there is any already HPV infection in the body, the vaccine does not eliminate the virus itself from the body. It's used as a preventive measure to not get the virus itself. And so the vaccine only prevents certain types of HPV infections. See, HPV is a wide variety of strains. So if there is a virus, then it is not a single virus which we are talking about. There are many strains in that virus. So examples are like, see, if you're seeing COVID situation currently, so that there was SARS virus. So it belongs to that family itself. There are in HPV also, there are many types of viruses, like strains of viruses, which would cause you infection. And these are usually Gardasil or cervarix vaccines are usually preventive in only certain strains. Like there are 16, 18, 31, 32, 33, 35. There are so the many strains are there. So these are preventive only for specific strains. And early vaccinations and regular pap smear tests and HPV tests, when recommended, are best used for protection or prevention against cervical cancers. So what should I expect at my vaccine appointment? So these are the most common questions usually people ask. So you will need a series of like 3 series appointments for over 6 months of period, and you will be receiving a shot usually in the upper arm at each of the 3 appointments. So common side effects include low-grade fever or a headache or sore arm at the site of injection or the vaccine shot. So you can you can cause over-the-counter pain and fever medications if required. But the vaccine should not be given if any female is trying to get pregnant or if she is already pregnant. Coming to the next most common cancer which is seen among women is breast cancers. And the risk factors which cause breast cancers are usually age, family history of breast cancers with either first degree or second degree relatives, and diet, first of all, obesity is alcohol. So early menopause is protective usually, and nulliparity is one of the most common risk factor which is seen. And then radiation therapy, prior radiation to your chest wall or to the breast, or initially there are like tumors in kids which we used to give for mantle radiation, which is usually seen in lymphomas or anything. So they used to give larger fields of radiation for younger kids, which is not practiced nowadays. But later they were prone for developing malignancies too. So one of the smaller causes for developing breast cancer maybe prior history of exposure to the radiation too. Coming to the self breast examination, like this is usually now according to the WHO guidelines, this has become obsolete actually because of the because they have not got the adequate data for supporting self-breast examination as one of the screening procedures. But still, I would like to put up on a slide because there are many people who had undergone self-breast examination and would have been diagnosed in early stages, which would have helped a lot for them. So that is why I would like to put a slide on that. So when in lying down position, usually the patient or the person can lie down on her back and with a pillow under your right shoulder, and use the pads of 3 middle fingers on your left hand to check your right breast. So when you're checking your right breast, you use your left hand, and if you're checking your left breast, you use your right hand. So opposite, and press using slight or medium firm pressure in a circular manner without lifting your fingers. So follow a up and down pattern and see if there is any changes in the breast above or below the collarbone or in your armpit. So if there is any swelling, then repeat it on the left side too. So see, single breast examination is not considered as an adequate self breast examination. So when you are seeing your self examination, then you should be equally done on both the sides. And then you should check for any lump or in the breast, or if there is any skin changes in your breast, or if there is any nipple retraction, or if there is any discharge. So you get to see specific symptoms or if there is any signs of cancers. So these tests may be repeated while bathing or showering, but you should not be using your soapy hands because if there is any small lump, it might slip away. So when you are in the mirror, look for all these changes which I have told. So hold your arms at your side and see if there is any asymmetry between both the breasts or not. And then hold your arms over your head and then see if there is any asymmetry or if there is any lump seen over the breast or not. And press your hands over your hips and tighten your chest muscles. Then bend forward with your hands on your hips and see if there is any tumor over in that regions. What these cause are like, usually breasts tend to fall, but these are usually if there is any chest wall infiltration. So by the tumors, they usually tend not to fall forward. So these are the common symptoms which I've already discussed about: lump on the breast, skin dimpling of the skin, and if there is any change or color or texture of the skin, and if there is any nipple discharge or retraction of the nipple, just like pulling in, and then if there is any bloody fluid or any leakage or discharge from the nipple. So most of the women who have many risk factors never usually develop breast cancers. Although very rare, men can also develop breast cancers. That is one of the things. See, it's not like completely absolute, but we have seen cases of men developing breast cancers too. So it's not wrong to see if there is any changes, or if there is any changes, then you can observe and report, or if you can go to a physician, or if you can go to a specified doctor to show up actually. So you can reduce your risk for breast cancer by adopting a balanced, healthy lifestyle and avoiding environmental carcinogens or if any substance abuses, and being physically active and reducing your weight and or alcohol intake. And usually women who breastfeed for at least 18 months have protection over the breast cancer. And they tend to develop lesser breast cancers rather than the other thing. So coming to the ovarian and fallopian tube cancers, these are a bit lesser, seen to a lesser extent, but still, these are one of the female cancers, common gynecological cancers we come across. So that is why most common risk factors, like seen in more postmenopausal age group of females, and with a strong family history of ovarian cancers, or see the breast cancers and ovarian cancers have a relation. These are like strong family history or family history in the sense there are genes which we can usually detect. These are called BRCA genes. So these are the genes which we usually check for to see if there is any family history or not. So these are usually expressed in ovarian cancers too, and often diagnosed late because these are usually symptoms commonly seen, and then they tend to progress showing to a doctor. Actually, they leave it the same way, saying that, thinking that it will be a normal thing. So coming to the risk factors, low parity, infertility. So these are the most common, one of the most common risk factors. And usually there are healthy, this picture usually represents this healthy ovaries. And if there is any localized ovarian cancer, or if there is any metastatic ovarian cancers. Metastatic in the sense it's already spread to the other parts of the body or to the peritoneum. So coming to the prevention of ovarian cancer. So nulliparity or infertility is one of the highest like risk factors for developing ovarian cancer. So having at least one child is protective, and oral contraceptive usage. So coming to the symptoms of ovarian cancer, majority of the symptoms are vague and non-specific symptoms. That is why people tend to progress or be diagnosed in the later stages than in the early stages. Abnormal vaginal bleeding in postmenopausal age group women, and the bleeding constipation, frequent urination, pain in the lower abdomen or distension of the abdomen, and pain during your intercourse. These are the most common symptoms which we get to see. So coming to the colorectal cancers. Any adult can have colorectal cancers, but rather than previously, now colorectal cancers are developing faster among women too. So initially they were like considered like cervical and breast cancers are the most common cancers among women. But current scenarios or current situations, the current lifestyle habits are showing that there are colorectal cancers, lung cancers, and oral cavity cancers have been growing upon women, apart from the breast and cervical cancers. So coming to colorectal, any adult can have colorectal cancers, and but most of these cancers are seen in people around age group of 50 or older. People with a family history of colorectal cancers, or who usually have polyps or in their colon or in the rectum. Those who have inflammatory bowel diseases like Crohn's or Crohn's disease, which are more likely to be prone, like slowly they might, like in years they might progress into a colorectal cancer. Initially it might be inflammation which we'll be taking medications for, but that long standingly might lead to a cancer. So also eating a diet mostly of high fast food like fat foods, especially from the animal sources, and overweight, smoking, physical inactivity like sedentary lifestyles. These are the most common causes. And the screening guidelines, I've already told you that regarding this, like fecal occult blood test, which is done annually, once in a year. Flexible sigmoidoscopy done usually in once in 5 years. Double contrast barium enema once in 5 years. Colonoscopy once in 10 years, or CT colonography once in 5 years. So these are the common screening procedures, or the tests which will be done for screening the colorectal cancers. And coming to the lung cancers, this everyone would have a general idea like smoking is the most common cause of lung cancer, and there are many tobacco control programs which had been organized by government, and to reduce the risk of developing lung or oral cavity cancers. So smoking is one of the most common, or 80% of all the lung cancers are due to smoking. But that doesn't exclude that people who doesn't smoke doesn't get a lung cancer. So they might be passive smokers, or if there is any family history, as I've already told. So what you can do is, lung cancer is one of the few cancers that can often be prevented simply by not smoking. So stop. If anyone's still smoking, I would recommend to stop smoking or slowly control your smoking. And if you are a smoker, ask your doctor or nurse to help you quit from the smoking. And if you don't smoke, don't start, and avoid breathing in other people's smoke. So if your friends and loved ones are smokers, help them to quit it actually. So that them and yourselves both will be at lower risk. So coming to the development, like developing 12 ways to reduce your risk of developing a cancer. So one is, I would not say these are the 12 things which will definitely prevent anyone from cancer. That I cannot say. But to an extent, it can reduce the risk of developing your malignancies or cancers. Are like, do not smoke or use any form of tobacco, and make your home smoke free, and support smoke free policies in your workplace, and maintain a healthy body weight, and be physically active in everyday life, and limit the time you are spent sitting idly or sedentarily. And the other one is, I think now a lot of people are into diet awareness and eating healthy foods, and to reduce your body weights. So that is one good thing. And it's like eat a lot of healthy diet, and limit your alcohol intake, or do not drink. So avoid too much of exposure to the sun, especially children. Early morning sun. I'm not talking about the early morning exposure of uh, sun exposure, but in the mid afternoon also, because of the UV radiations. And if you work at the work in your workplace, protect yourself against cancer-causing substances by following health and safety instructions. And the other one is, determine whether you are exposed to radiation from high radon levels in your home. Reduce high radon levels. And then for women, breastfeeding, and limit the use of hormonal replacement therapies, which can usually lead to cancers. So the other one is, reduce your child's risk of developing a cancer. Ensure that the children are vaccinated at the correct ages against the hepatitis B, human papilloma, HPV virus vaccines, so which can prevent cancers to certain extent. And take part in organized cancer screening programs, so that you get to develop more awareness more awareness regarding the cancers. So these are the ways, some of the ways, so people can reduce or prevent to some extent of developing malignancies. So there are many myths in our country, which not only in our country, among many people everywhere. So there are many myths that about cancer, or misconceptions I call about. So cancer is a death sentence. No, definitely it is not. Not for everyone. But see, if you are diagnosed in the early stages of cancer, there are good treatments nowadays through which you can you can lead a longer life actually. And the other one is, pain is an early sign of cancer. Definitely no. Not in all the cases. Yeah, pain might be one of the symptoms which are seen in malignancies, but not. That is not the first sign which you see in malignancy, or every pain is not a tumor or malignancy. So the other one being, if you ignore the symptoms, then they'll go away. No, definitely they're not. So when they are diagnosed early is better than diagnosing late in a kind of malignancies or cancers. So cancer is a communicable disease, definitely no. And all cancers are hereditary, no. So these are the common myths and misconceptions which people usually tend to think about cancer. And these are the cancer awareness ribbon colors. So you guys have been actively participating in cancer awareness programs. So you people will be knowing better than me, though being a radiation oncologist or an oncologist in specific. So these are the most common cancer awareness ribbons which people tend to use for specific cancers. So the other one being, best defense against cancer is early detection. Finding a cancer early before it has spread gives you best chance of survival, or something to do about it regarding the treatment. So knowing about these cancers and what you can do to help reduce your cancer risk can save your life and your family's life both, or your friends with whom you are living with. So do you have any other questions for me? I'm glad to answer. I know this has been an extensive class, but thank you everyone for providing me this opportunity for talking about the awareness, like for talking about the cancer awareness among people. So contribute for like thank you for making me a smaller part in your awareness programs and making people realize what cancer is.
Thank you so much, Doctor. The floor is open now for the questions. Students can ask questions.
Doc, I wanted to ask you, you said cervical cancer vaccine shouldn't be taken after the age of 25, is it? For a female? You don't recommend the cervical cancer vaccine after the age of 25?
Not more than 30, I would suggest, because see, there are screening guidelines and there are practical methods also, which we see. Like not more than 30 years of age group is not that recommended, because they have lesser chances of getting prevented rather than in the younger age groups. When you give in younger age groups, you get more prevention from the infections.
I see. Oh, I
Because
see.
the later age groups are mostly exposed to already, they might be exposed. See, person's intercourse, starting the age of intercourse or multiple sexual partners or other hygienic environments or about the awareness of the cleanliness or hygiene, everything would be an exposure or a risk factor for developing a malignancy. So it which increases with your age group.
Oh, I see. Thank you.
So like डॉक्टर, do you recommend कि हमारे स्टूडेंट्स जो 25 साल से कम एज के हैं उन्हें सर्वाइकल कैंसर का वैक्सीन लेना चाहिए? Do you recommend that?
I would recommend if they are less than 30 years of age, I would recommend people to take cervical cancer vaccines. See, though they have already been exposed, might be exposed to HPV infections, but there are at least as few chances of getting prevented. So I would recommend for age group of less than 30 years or 28 years, I definitely recommend. Starting from the age of 9 to 11 years of age, which is usually people usually don't give HPV vaccines at that age, which we are seeing in this like current scenario. But it would be very grateful, or if it would be very helpful if people start taking vaccinations at that age group and trying to prevent it actually.
Thank you. Any more questions?
Yeah, I got a question actually. So once the cancer is cured, can it come back? So yes, definitely it can come back. I have not said definitely, but yes, I have seen many cancers or many recurrence cases in my career as an oncologist. Yes, I have seen many cancers which are recurrent. So people tend to take complete treatment, and I have seen developing cancers and people who had not taken treatment, they might progress it, or people delay treatment in between. Like, see, if there are oral cancers, we take surgery, radiation, chemotherapy, everything. There are like part of treatment, a group of treatment. So once you take one treatment and delay in the next step of your treatment, yeah, there are chances of developing a recurrence of that tumor. So the other question is, can tuberculosis lead to malignancy? No, I would not say so. That is a cavitary infection, and that might not lead to malignancy. I've not seen a tuberculosis patient getting malignancy right until now. TB is a bacterial infection, so no. So a patient, so 50 to 55 years of lung cancer age group, can they survive? See, lung cancer is one thing. If diagnosed early, there are very good treatment options for lung cancers. So whatever the age might be, the stage at which the cancer is diagnosed is more important than the age group, is what I feel nowadays. There are patients whom we have seen in the later age groups also who had been diagnosed with malignancies, and they have received a very good treatment and they are still on follow-ups. So stem cell therapies, no, that are like most commonly goes to blood, goes to hematological malignancies, not for all the cancers. So any other questions?
doctor, you mean to say that stem cell therapy will not work in preventing cancer? Only dermatology, that's it, no problems. But
Sorry, ma'am, I am not able to get you.
I'm saying like there was a question like what is stem cell therapy and does it prevent cancer? So you said that it's only for the dermatological cancer. So only for that stem cell will work, not for all the cancers.
No. See, ma'am, it's not autologous stem cell transplantation is one of the treatments usually used in cancers, but they are usually used in hematological cancers, and they are used in patients like after post chemotherapy. They tend to use stem cells for transplantation, autologous or the other ones. So stem cell transplantations are usually not preventive. I would say they are used in for the treatment of the cancers.
So does
There
stress
are
lead
stem
to
cell
cancer?
transplantations which are going on for hematological malignancies. But that is usually done post chemotherapy.
Mitali, repeat your question,
I was
please.
asking, does stress lead to cancer?
Sorry, ma'am?
Does stress lead to cancer? Tension, stress, does it lead to cancer?
Stress leads to cancer. See, stress usually doesn't lead to cancer, but stress causes overeating and overweight. Yes. So they don't develop stress in the sense like, yes, that would be a smaller part, I would say, because see, stress directly doesn't lead to cancer itself, but stress causes there many other risk factors to develop which might lead to cancer. They tend to overeat, or they tend to develop a sedentary lifestyle. Yes, that will definitely, in long standingly, that might lead to, but not stress per se would lead to. But the factors would lead to, like post stress.
Thank you.
Yeah, well.
Any other question? Manju Singh, are you interested in asking something? Dr. Manju Singh, are you there?
I'm there.
Yeah. Yes. Are you interested in asking something?
No, I'm listening to her because I have gone through so many things that what question should I ask? Yes, doctor, one thing, my follow-up was due. I am a cancer survivor. I go to Mumbai, but it was due on 11. But I could not, because due to this pandemic, we are not supposed to go there. But I wanted to call on phone and have chat. So it's this year. I'm going after 1 year. Before it was 6 months, but this year it was 1 year. So after 1 year, I was supposed to go there, but I could not. So can I get it checked here also? In MTMH also I can get
Yes,
it
ma'am.
checked. That I'll see. I'll
Yeah,
talk
sure, it can
to.
be.
Okay, I'll take the appointment, talk to Sujata, and then I'll come. Okay, because I want to
Sure,
get
sure.
it checked. It's 1 year almost.
Sure, sure.
But yeah, I was
Yeah.
listening. It was very informative, which you talk about every details of it, and yes, it is very beneficiary. Yes, we can see because in our case it was something hormonal due to age. Yes, early menopause. You can say they said that also. So I think what should I say? It was third stage cancer, and but it was cured. It is cured, but still recurrence chances are there. But then also we keep ourselves healthy, fit. So no problem, no question as such. But it was very informative. Thank you so much.
Hello, I have a
So
similar
there was one
question to
more,
ask.
like in
I have a
COVID
similar
19,
question to
so they can.
Somebody is asking a
Sure,
question, I
sure.
think.
Pushpinder
Can
ji,
I ask?
Pushpinder ji. Yes.
Yes, I have a similar question to what Manju said. I'm also a cancer survivor, and my recurring that tests were due in March. And when I went there, and I was by the doctor wrote down, and just then this pandemic started, so never went through the whole checkup. Now, so many, as it is, it was 6 months, and now another 6 months have gone. So, how this thing is it? How should I go and get it done? Where is it worth taking the risk?
Beautiful हो गया था ना अभी?
No, one thing I would recommend is yes, regular follow-up is very helpful or very needful to develop. So if you see if there is any recurrences or not, that is one thing. But if you have missed a follow-up, that could be done. That shouldn't be a problem. And due to the situations, current situations, COVID situations, if people
I
are not able to go
I had
to get the center,
not properly. I had cancer of the kidney. So to get myself, is it very essential? Because there are no symptoms as of yet the first time also. Just to get ultrasound and stuff done, but because of all this pandemic and all the things in the TMA, one has just not gone, and it was also said you can avoid doing
yeah.
it, you can do it later, but how much later, because this thing is going on and on.
So you can get it checked in the nearby centers of you, like nearby centers. That would be very helpful. You can get checked
One
out.
more
You can
question.
get a follow-up done for nearly your nearby centers. I know the current situations are not that great for going for a follow-up
Thank you. I
also,
will.
but
Yeah.
still,
Yes. Excuse me. I wanted to ask that I am taking tamoxifen for last 5 years. I was detected in December 13, and everything. I had 2 operations and 16 chemotherapies and 20 cycles of radiation and all. So it completed almost. It took 1 year, and after that, I am taking regular every day. I am taking tamoxifen.
yes, it should show 5 years.
I think it's fine. People say there are so many. I also read, read it about the medicine and all. You know that. So sometimes doctors used to say that if you are taking chemo, don't read what is given, huh? Because I was having Paxitaxel. Yeah. So they said don't read about it. So because you read too much. So, but it was. I said no. I should read because I should know at least, and I know. So it was okay. But I think there is no substitute of medicine of tamoxifen. I wanted to know that because my one of my friends
There
was
are other
having.
hormonal therapies.
She was taking this medicine, but later on it was replaced by some other drug. So I asked last
Yeah.
time in.
She's answering. Dr. Vaishnavi is answering. Yes,
So
Dr.
yes,
Vaishnavi.
that medicine usually that is hormonal therapy is different for premenopausal and the postmenopausal women actually. So premenopausal, perimenopausal usually you take tamoxifen, but postmenopausal usually they take letrozole or anastrozole. So they tend to go into letrozole. So they take different hormonal therapies based upon your menopausal status.
Yeah, that's why last time they said, I asked the doctor that why don't you change my medicine? It is so old. And yeah, so they said, Dr. Sarin was there. He said that don't talk about it. You have to take this medicine only. We can't change your medicine because there are certain parameters which they see. So he said that tamoxifen is the best for you.
Okay.
So
Okay. Thank you. Thank you, Dr. Vaishnavi. I think the time is also up for you. You also have to join your OPD. I will request our co-convener for awareness, cancer awareness, our PP Mitali Chopra, to please present the vote of thanks. Mitali ji.
So, Thank you, Navita. Good morning, everyone. And thank you, Dr. Vaishnavi, for such a brilliant and insightful talk on the subject, which most of the people dread to talk about normally also, and especially you do not talk to the youth. So I'm sure the students must have gained a lot today in terms of knowledge. And also it would inspire us to make certain lifestyle changes to accommodate more healthy way of living. So thank you so much for the same. I would also like to extend our gratitude to the principal of Loyola College, Dr. Anthony Raj, Dean Dr. Monica Opal, teachers and staff of such a great institute for opening their venue and also their hearts out to us and for making this event possible. I would also like to acknowledge the students who have taken so much of interest and been there all through to listen to this talk. It was a solemn talk, and thank you for being there and listening to it. And I would also like to extend our special thanks to the organizers, Innovi Club of Jamshedpur President Navita Prasad, convener J.P. Grewal. I would also like to thank our past presidents for their presence and always motivating us by being there, the members for taking so much of interest and being with us here today. Special thanks to Manju Kumari for commencing the program with such a beautiful rendition. I'm sure you set the tone of the day to come. So thank you for the start of a beautiful day. And thank you, everybody, for your presence. Stay safe, be healthy, and take care of yourselves. Thank you so much.
Thank you, Mitali Di. Monica, can we have the national anthem? I think we will be ending with the national anthem.
Okay. Stand up to the national anthem. Manju Kumari, you can start. You can lead. Can we stand to the national anthem? Are you there?
The others can please switch off their mics. Thank you.
Kindly mute your. Serene, are you there? Anyone who can just unmute and leave? Any student? Deepika, can you begin?
Yes, ma'am.
Begin.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल गंगा हिमाचल यमुना जलधि तब शुभ नामे जागे तब शुभ आशीष मांगे गाए जय गाथा जगन मंगल जय हे जय हे जय हे
Thank you, everybody. Thank you so much. Students,
Thank you.
11:20. You'll begin your class at 11:40. We'll have 20 minutes of break and you'll begin your classes at 11:40. Instead of 11:30, we'll have it at 11:40. We'll start with your method classes. So you can take a break of 20 minutes and then we'll begin with our class. Thank you all the dignitaries. Thank you so much for your presence. Thank you, Doctor.
Thank you.
So you all can leave the meeting now. Thank you so much.
Thank you, ma'am.
Welcome.
Thank you, ma'am.
Welcome. Thank you. Thank you, Jaya, for that lovely, beautiful
Thank you,
explanation.
ma'am. Thank you, ma'am.
Thank you, Sita. Thank you so much. So, Navita, I hope it was good.
Yeah, it was a wonderful show. Thanks a lot, Monica, for your cooperation and support. And I got disconnected in the middle.
I cannot hear you. I cannot hear you.
Okay. Now can you hear me? No? I'll speak to you over the
I cannot hear you.
Okay. Okay. I don't know why. There's a connectivity issue, I guess.
I cannot hear you. I'll speak to you over the telephone. Okay.
Right. Okay.
All right. Okay. Thank you.